Hi, I'm Kevin Hall. I'm an instructor here at West Coast Florida CPR. I'm here to explain to you guys about third degree heart block, second degree type 1, second degree type 2. So we're going to show you how to find out if it's a third degree heart block. The first thing you'll want to do is go ahead and get rid of the third degree heart block as a possible choice. The way we do that is we use our finger calipers. And what we do is we look at the R to R wave. Here's your R wave. There's the next one. What we want to do is see if they are normal. So the R to R wave, as you can see, is really running right by themselves. They're not looking at the P waves. The P waves are doing their own thing, but we also have the R to R's are exactly the same. So first thing we do is it a block? We have a P wave without a QRS complex. So that shows you that it is a block. So now we got to assess whether it is a third degree, whether it is a second degree type 1, second degree type 2. So what we'll want to do is look at our R to R waves using our finger calipers. So as you use your finger calipers, you notice that the R to R's are exactly the same every time. And so if the R to R's are the same every time, you're looking at a third degree heart block. So now we're here with a different type of heart block. So we got to find out, is it a third degree? So let's get our finger calipers and take a look. We're checking our R to R's, but we're missing one. So immediately we know it's not a third degree heart block. So we're going to get that out. So now we want to look at the PR interval when we get a QRS complex. So as you see the PR interval, the little P between the R wave, when we look at that, we're going to see that the PR interval is exactly the same each time we have a QRS complex. So that makes this a second degree type 2. So now we're going to look at a different one. So what we need to do is look at our R to R waves to rule out a third degree heart block. So let's get our finger calipers and give it a shot. As you can tell, it's not the same. We'd have one right there. So it looks like we got 4 in there and it's missing one. So to make sure that we know we're dealing with a block again, we're going to see a P without a QRS complex. Then we look at the R to R waves and see if they march out, and they don't. So there's a missing one there. So it means it cannot be a third degree heart block. So at this point in time, we got to look at the PR interval to the QRS complex. We notice that they are different. So if they're different and not the same length, we're going to be calling it a second degree type 1, also called a Winky Bach.